Comment your name and state below. I'd love to see who's watching and benefiting from these videos. And let's be honest right from the start, if you're turning 65, already on Medicare, or helping a parent figure this out, this decision can feel overwhelming. I've talked to thousands of people over the years, and almost every single one says the same thing: I just don't want to make the wrong choice. That fear is real, and it's completely understandable. Most Americans eventually face the same fork in the road. On one side, you have Medicare Supplement plans, often called Medigap. On the other side, you have Medicare Advantage plans, also known as Part C. Both exist to fill the gaps left by original Medicare. Both can work. And both can also frustrate people when they don't fully understand how the costs actually play out, especially as we move into 2026. Today, we're talking dollars and cents. Not sales pitches. Not scare tactics. Just how these plans are structured, how money flows out of your pocket in good years and bad years, and how recent 2026 updates, especially around dental coverage in Medicare Advantage, fit into the bigger picture. Let's ground ourselves first. Original Medicare is Part A and Part B. Part A covers hospital stays, skilled nursing, hospice, and some home health care. For about 99% of people, Part A has no monthly premium because you or your spouse paid Medicare taxes for at least 10 years. You already earned that coverage. Part B is your medical insurance. Doctor visits, outpatient care, preventive services, lab work, imaging, things like that. In 2026, the standard Part B premium is about $22.90 per month, just under $2,435 for the year. Some people pay less if they qualify for Medicaid. Some pay more because of higher income from 2 years ago, thanks to IRMAA. But regardless of which path you take next, Supplement or Advantage, Part B is non-negotiable. You pay it either way. And this is where confusion often starts. Original Medicare leaves gaps. Big ones. It generally covers 80% of approved Part B services, leaving you responsible for the remaining 20%, with no cap. There's also no built-in dental, vision, or hearing. That's why most people add something on top of it. If you go the Medicare Supplement route, you're buying protection. You pay higher, predictable monthly premiums in exchange for fewer surprises later. In 2026, the most popular Medigap option remains Plan G. On average, a 65-year-old might pay around $175 per month nationally, or about $2,100 per year. That premium is there whether you use the plan or not, and it usually increases as you age. Plan N is another popular choice. It costs a bit less, around $150 per month on average, but introduces some small copays for certain doctor visits and emergency room use. Then there's high-deductible Plan G, which has much lower premiums, around $60 per month, but requires you to pay more upfront before coverage kicks in. With any supplement plan, you'll still need a separate Part D prescription drug plan if you want drug coverage. In 2026, the average Part D premium is roughly $35 per month, and that's been a pain point this year because of all the changes tied to the Inflation Reduction Act. Drug deductibles are higher, plan designs have shifted, and many people are surprised by how different Part D looks compared to just a few years ago. Now let's talk Medicare Advantage. This is where the conversation feels very different emotionally. For many people, the appeal is simple: lower monthly costs. In 2026, most Medicare Advantage plans still come with $0 monthly premiums. You still pay your Part B premium, but the plan itself doesn't add another monthly bill in most cases. That alone explains why so many people choose Advantage plans. Fixed-income retirees often tell me, "I can't justify paying $400 or $500 a month in premiums if I'm healthy." And that's a fair concern. Advantage plans usually bundle everything together. Medical coverage, prescription drugs, and often dental and vision, all in one package. And here's where 2026 matters. Dental coverage in Medicare Advantage has become more standardized, but also more nuanced. Many plans now offer higher advertised dental maximums, sometimes $2,000 or more, but with tighter networks, frequency limits, and pre-authorization rules. For example, you might see coverage for cleanings, exams, x-rays, and even some major services like crowns. But the fine print matters. Dentists must be in network. Some services require waiting periods. Others may have percentage caps. The coverage exists, but it's not unlimited, and it's not the same everywhere. With supplement plans, dental is not included at all. If you want dental coverage, you buy a standalone dental plan, often around $50 per month. That's an extra fixed cost, but it also gives you flexibility to choose a dentist and plan that fits your needs. So when we compare costs, we have to be fair. We can't just say, Advantage is cheaper, or Supplement is better. We need to look at fixed costs and variable costs. Fixed costs are what you pay no matter what. Premiums. If you never see a doctor all year, these still come out of your pocket. With a Plan G supplement, Part B plus the supplement premium plus a drug plan plus optional dental and vision can easily push fixed costs above $5,900 per year per person. With an Advantage plan, fixed costs might be as low as $2,435 per year, just the Part B premium. That gap is real. And it's why so many people stop the analysis right there and choose Advantage. But healthcare doesn't always cooperate. Variable costs are what you pay when you actually use services. Deductibles, copays, and co-insurance. With Plan G, after you pay the Part B deductible, which is $283 in 2026, almost everything Medicare approves is covered. No copays. No surprise bills. You can see any doctor nationwide who accepts Medicare. With Advantage plans, you pay as you go. $20 here, $40 there, sometimes more for hospital stays, outpatient procedures, or specialists. These costs accumulate until you reach the plan's maximum out-of-pocket limit. In 2026, the average in-network maximum is around $5,900, though some plans are lower and others go all the way up to the federally allowed maximum of $9,250. Most people never hit that maximum. Only about 3 to 5% do in a given year. But if you're the one who does, that's not a statistic, that's your bank account. This is where the emotional side of Medicare decisions really shows up. Some people are comfortable with risk. They're willing to save money in good years and accept higher costs in bad years. Others want certainty. They want to know that no matter what happens, their financial exposure is limited. Neither mindset is wrong. Let's bring this back to real life. Imagine two retirees, both healthy at 65. One chooses a Plan G supplement. The other chooses a $0 premium Advantage plan. For the first few years, the Advantage enrollee saves thousands of dollars. They use that money for travel, hobbies, helping grandkids, or just peace of mind. Then something changes. A cancer diagnosis. A series of surgeries. Frequent specialist visits. Suddenly, the Advantage plan member is paying copays all year and hits the max out of pocket. The supplement enrollee pays their premiums and their small deductible, and that's it. Over 1 year, the Advantage plan might cost more. Over 10 years, it might still cost less. That's the trade-off. Dental coverage plays into this too. In 2026, many Advantage plans advertise generous dental benefits, but people are learning that covered doesn't always mean paid in full. You may still have cost sharing, limited provider options, or services that simply aren't included. For someone who values flexibility and already has a trusted dentist, a standalone dental plan paired with a supplement might feel safer. One of the biggest mistakes I see is people trying to get the best of both worlds. They want the low premiums of Advantage and the unlimited flexibility of supplements. Unfortunately, that combination doesn't exist. You have to choose which trade-offs you're more comfortable with. Another common misunderstanding is switching later. Many people assume they can start with an Advantage plan and switch to a supplement anytime. In reality, in most states, switching to a supplement later requires medical underwriting. That means health questions, and possibly denial or higher premiums. So this isn't just a one-year decision. It's a long-term strategy. If we zoom out, purely on dollars and cents, Advantage plans often win in good years. Supplement plans shine in bad years. Over decades, results vary based on health, inflation, premium increases, and personal comfort with risk. And here's the truth that doesn't make flashy thumbnails. Medicare is not one size fits all. Some people sleep better knowing their costs are capped tightly, even if premiums are higher. Others sleep better knowing they're not overpaying for coverage they might not need. If you've made it this far, you're doing exactly what you should be doing, learning before choosing. That alone puts you ahead of most people. Remember, this conversation today was about structure and cost. There are other factors, networks, referrals, prior authorizations, travel coverage, that also matter and deserve their own deep dives. So before you decide, ask yourself a few honest questions. How comfortable am I with financial risk? How important is provider freedom to me? Do I value predictable costs or lower monthly expenses? And how does dental coverage in 2026 realistically fit into my life, not just on paper? There's no universal right answer. There's only the right answer for you. If you found this helpful, comment your name and state below. I really do read them, and it helps me tailor future videos to what you actually need. And as always, I'll see you in the next one.